wonderful afternoon to you all. My name is Dr. Gerald Mataruka, and I am founder of Indoda Health and Wellness. So, Indoda is a men's health and wellness initiative that is focused on bringing men's health issues to the fore, to bring about discussion about men's health issues and to empower men to lead healthier lives. So I'll be with you this afternoon for the next 20 minutes or so, and we're going to be talking about circumcision. Right? We will be talking about circumcision, looking at the procedure itself and why this procedure is done in terms of the benefits and any associated risks that go with this procedure. Just as a disclaimer, this talk is focusing on just the health benefits and risks of circumcision. It's not necessarily focusing on all the other things that are associated with circumcision, such as the culture behind it and the meanings that are behind it. And this tip of penis is a number of reasons why this is done, of which I'll go into. But the origins of this procedure, ancient Egyptian times. This is even pre-biblical times. It was mostly for either religious or cultural um, reasons. And circumcision happens in many areas or parts of the world, um, in many religions, including Jews, Muslims, and it also happens with many African cultures. So that is circumcision, and it is an important topic on its own that we all need to be aware of. So, just look at some stats. So, worldwide, we know about one third of the world's male population is actually circumcised. And then, when we look at South Africa, this is based on a study that was done in 2014 by Pertsa and others. So, this study estimated the prevalence of circumcision in South Africa to be 42.8% amongst all South Africans. And amongst the Black African population, uh, the prevalence was 48.2%. So almost half of all males in South Africa, give or take, are circumcised. And when you go into that Black African cohort and you look into which are the different subtypes or which are the different cultures, what composition they make. So you find in different cultures, cultural backgrounds, they have got higher rates of circumcision. So, for example, the Wavenda people, they have up to about 82.7% of their males who are circumcised. In northern Soto populations, it's almost 80% and about 78%. And in Xhosa ethnic group, it's up to 74% of males who are circumcised. Shitsonga populations up to 67.6%, and in developed populations about 54%, and in Zulu and Swati populations, the prevalence is not as high, being about 24 and about 18%, respectively. And they found that in this cohort of Black African males who were circumcised, about three-quarters of them actually undergo traditional circumcision, and only a quarter of them will actually undergo medical circumcision in a clinic or a hospital setting. All right. So when can circumcision be done? So circumcision essentially can happen at any age, right, up from newborn to any age, and up to about 1/6 of all circumcisions that happen in South Africa are actually neonatal circumcisions, meaning that this happens directly, immediately after birth, within the first 2 weeks, usually in the first few days. And then with other cultures, it tends to happen either in pre-adolescent phase or in the adolescent phase or around about the age of 18. However, you can opt to have a circumcision at any time, or there could be certain medical conditions which would warrant you to have a medical circumcision being done. So, um, so when I look at the benefits and the risks of circumcision, of which we do know that there's quite a lot of benefits of circumcision. But before we go to that, we will speak about male medical circumcisions. Like, so, male medical circumcision is a program which has been adopted in many African countries, where essentially regions that have high prevalence of HIV are advocating for a large proportion of their population to be circumcised as a preventive strategy to combat HIV and AIDS. As we know that males who are circumcised have got a decreased risk of contracting HIV and AIDS compared to other males. So in South Africa specifically, they were targeting that if about 80% of males between the ages of 50 and 49 could be circumcised, that was going to lead to about an extra 4.2 million males who were going to be circumcised. And this would have led to a reduction of about 1.2 million cases in HIV and AIDS just through male medical circumcision. So it is a very important subject. So this is why it was being advocated for, and there are a lot of media campaigns around male medical circumcision. You'd hear on the radio adverts talking about a chomi hambienzi upgrade, or go for the big snip, or referring to male medical circumcision. And there's a number of reasons why somebody would want to be circumcised or choose to circumcise, of which predominantly the main reasons, it's a rite of passage. So usually it marks from transitioning from being from boyhood into manhood in many cultures. And there's a lot of other religious beliefs, not just cultural, that drive why um, males may elect to be circumcised. And then for a smaller proportion of people that were quoted in the study, for some of them, they actually about a fifth, about 20%, said the reason for them for circumcising was actually there was a lot of pressure, coming from their their peer group, because if everyone else is doing it and you're the one, it's sometimes with cultural norms and practices, those who are not circumcised, you know uh, may be cast out or may not be as recognized as those who are. So there's quite a bit of pressure that arises, and for some, a very small percent, about 1%, said they actually felt forced, that they didn't want to do it, but they were actually forced by relatives. But just to show you that there's a lot of influence on the decision for one to elect, whether to be circumcised or not, coming from society, the peer group, and even female partners as well. So this is something that has happened for some men. So coming to the benefits, so the main benefits when it comes to male medical circumcision would be reduction in the risk of sexually transmitted illnesses, primarily being HIV. And it has been found in studies done in Africa, in Kenya and South Africa, that up to between 38 to 60%, 38 to 66% reduction um, in in your chance of contracting HIV if you are circumcised, which is quite a big reduction. This is why it's been identified as a strategy to combat HIV and AIDS in high prevalence areas. So that is the main benefit. However, it's not only a benefit with HIV and AIDS. There are other sexually transmitted illnesses where circumcision is beneficial, such as with syphilis. There's about a 50% reduction in your risk of contracting syphilis if you're circumcised, and with other illnesses such as chancroid, which is genital ulcers, um, your 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 reduction in risk is greater than 10 times to the non-circumcised counterpart, which is quite a big reduction, and also a reduction in other sexually transmitted illnesses such as HPV, which is human papilloma virus, which is the virus that is predominantly behind causing genital warts and also causing cervical and penile cancer. So there's a big risk reduction when it comes to sexually transmitted infections. The other benefits is that there's a decreased risk of 3 to 4 times um, of, of penile cancer compared to non-circumcised males, and there's also a risk of there's a decreased risk of female cervical cancer. So if a male is circumcised, they actually could beneficially their female partner reduce cervical cancer. As I said, because with circumcision, you've got reduced chances of HPV, and HPV is the virus that actually drives cervical cancer as well. And then other things, another benefit would be that it simplifies the task of maintaining cleanliness. So you can see there's quite a lot of benefits that exist or as to why someone could be should be circumcised. So those are the main benefits associated with circumcision. And once I just slightly deviate from the benefits, I want to touch quickly on what are the medical indications for one to be circumcised. There is quite a few. So there's what we call relative indications, in which it's not an absolute must, but it's probably advisable and is beneficial if you do. So this would be men who suffer from recurrent pyrophymosis, which essentially is when the foreskin retracts and can no longer protract backwards to its original position, and there's swelling of that foreskin and associated pain. So that is a reason. If there's infection of the foreskin itself or of the glans penis, or what we call the head of the penis, that would be another reason. In those males who are suffering recurrent UTIs, and this tends to be more in your younger age group, more your neonates, that could be a reason for circumcising. Men who suffer from penile cancer, circumcision could be beneficial, and as I've mentioned, in those who are acquiring recurrent sexually transmitted infections. And then where you'd have your absolute contraindication, where it's almost definitely advisable to circumcise, would be in men who are suffering from a condition that we call BXO, which is balanitis xerotica obliterans, which is a chronic inflammatory condition of the penis and the head of the penis, which tends to be progressive and causes a lot of other complications or health issues. So those are medical uh, reasons for circumcising. So now, what are the potential disadvantages of medical circumcision? So disadvantages which have been noted by men who have circumcised in the literature would be as follows. So some men would report that there's decreased comfort, or there's general discomfort, especially initially after the procedure. Why? Because your foreskin was provided that mucus covering that helped to protect the head of the penis, as well as um, naturally lubricate or keep the moisture there to prevent dryness on the head of the penis. So that is one reason. Some have reported having experiencing urinary difficulties. That is usually soon after undergoing circumcision. It is something that is in most instances transient. Um, there's also issues that have been noted of decreased sensitivity of the penis, which leads to decreased sexual enjoyment when engaging in sexual acts, intercourse, or even masturbation. This has been reported in many different literatures. Um, However, there are other articles which, contrary to these other ones, which would say that there's actually no change or effect on the sexual performance or satisfaction with circumcision. So it's really one of those where it is controversial. Some studies say there is an effect on sexual pleasure and sensitivities. Others say there isn't. So I don't know. Yeah, perhaps maybe more studies on that one are needed. And there's also some ethical and consent issues that arise with circumcision, predominantly in the age groups, the neonatal age groups, or in in children, where essentially some people would say that if you were to routinely just circumcise children, you are actually exposing them to potential risks and complications from undergoing the circumcision, of which, if they were able to choose for themselves, if they were at an age where they were able to choose whether they wanted to circumcise or not, they might have not opted to circumcise. So there's the issues of autonomy and informed consent that arise to say that, is it right that as adults we can choose um, blanketly for our children that this is what we're going to do with their body organs, especially when, if that decision could be delayed for years, it doesn't lead to an extra health risk. So that this is some of the things that some people say. And then obviously there's, like with any medical procedure, there's complications that are associated with circumcision, and the majority of these complications are mild complications, and in the minority, some of these complications are actually quite severe. So it is very important that we need to be aware of this. And there was actually studies done in Kenya and in South Africa that show that, particularly with traditional circumcision that happens at, initiation camps in the mountains, etc., that complication rates could be as high as 34 or even 48%, which is actually quite a high rate if you think about that. One in two um, children or boys or men that undergo circumcision could suffer from complications. uh, Taken from a study that was done in the Massachusetts General Hospital in the United States of America. So this is a first world setting. They reported complication rates between 1.6% to about 7.4%, which again is also quite high for first world settings. So there are complications that can occur with circumcision, which goes into the disadvantages which we need to be aware of, and I'm gonna briefly touch on those. So as I said, most of them are minor complications, and would be complications such as pain from the procedure and from the healing process. So this could take even as much as up to 4 weeks or even 8 weeks, whilst total healing of that wound occurs. It could be painful. You could have bleeding, of which you can have significant bleeding early on with the procedure, especially if the patient has got other conditions that could lead to a bleeding situation. So there's complications of bleeding. There's also the complications of wound infection of that particular wound. So that those are your early complications or your minor complications that could happen. Amongst your serious complications, so you would uh, branch your serious complications into early serious complications and late serious complications, of which the early ones, you can get complications such as a penile cord, which is essentially a downward curvature of your penis, which is away from, which deviates from the normal shape. You can get infection of that penis. It affects the blood supply, causing what we'd call glandular necrosis, meaning the head of the penis no longer gets blood supply, and essentially that um, part or organ, that head of the penis could actually die. The cells die and can actually become black if the blood supply to that penis is affected as a complication. And what you would end up happening is you end up having glandular amputation, meaning that part that has died, that is um, been affected, the blood supply could actually fall off. And then there's other infections that could happen of the perineum, what we term necrotizing fasciitis, and then also as well you can have suture sinus tracts, where your sutures were from the time of the circumcision. So this will be your early complications, and then you get late serious complications, which could be like wound dehiscence, meaning that your wound breaks down. You can get urethral-cutaneous fistula, which means an abnormal connection with the skin on the shaft of the penis and actually the urethra, which is the pipe that drains the bladder that carries urine. And also as well, the meatus could actually become stenosed. The meatus is the part of the penis at the most distal tip, or the most furthest tip, where the urine actually comes out, and that hole could actually close and become smaller, leading to other complications. So there's a number of complications that can occur with circumcision. Of one of them I mentioned was of granular necrosis. I remember a case that we saw in our practice last year, where a 13-year-old boy, I believe, who underwent circumcision at a clinic, one of the clinics that do circumcision, and as a result, a few days later, developed what we call granular necrosis. Part of the head of the penis became black and eventually fell off as the blood supply to that area had actually died as a complication. So circumcision, as much as it has got a lot of health benefits, it is a procedure that can be associated with having harms or risks that are associated. So it's important that we be aware of these risks, and we we should know that if you're going to undergo this procedure, these are some of the things that could occur. I think it's also important for government to continue, as they've been doing, to advocate and to implement policies that ensure that there's safer traditional circumcision, which happens, as you know, in the last 10 to 15 years. There's been a lot of limelight around dead set initiation schools or from traditional circumcisions. So we need to ensure that those policies are adhered to make sure that these traditional circumcision that happen are done in a safe way, with good sterilization techniques, good clean techniques of razors that are used, and techniques that allow healing of that wound, so that there's little complications as possible. But not only on traditional side, but even in health setting as well, clinics and hospitals, and ensuring that healthcare workers have got the appropriate level of skill that is needed to be able to carry out these circumcisions safely. So that is essentially what you may need to know about circumcision. I know a lot of people have questions, especially some people who may have young children. They question, when should I take my child to circumcision, to be circumcised? Where can we do it? And I actually see a lot of single mothers who have boy children, but maybe because they may not have um, other male figures in their lives to help them with this question, they tend to struggle with it a bit. So there are a lot of places where you can get a safe circumcision and enjoy the benefits of. But however, you need to evaluate the risks and the benefits and know what is your reason for wanting to have circumcision, whether it's medical based, whether it's cultural or religious based. And I think there is a role in the discussion of saying, should we be letting children or boys to have that choice or their decision for themselves, as opposed to adopting a blanket rule that before they are actually even able to comprehend what the procedure entails or whatever complications, that should we circumcise them or not. So that is essentially what I have for you today. Please, if you could engage in the comments, or you could even send us a direct message on your thoughts or your experiences around circumcision. I would appreciate that. If you missed this live video, you'd be able to find it on our on our page, on YouTube, on our YouTube channel, Indo the Health and Wellness. And you can like and subscribe our YouTube channel for more great content. Otherwise, you can find us on Indota underscore wellness on Instagram, and then you can also find us at Indota Health on Facebook. So thank you very much for giving me your time, and it was a pleasure till we engage again on another topic. Thank you.